I will be talking today about functional and regenerative medicine. So I started practicing, about 11 years ago. And my intention after I did a fellowship in anti-aging and regenerative medicine was really to focus on internal health. I had a very keen interest in hormones because of things I had gone through. And I learned quickly within about a year into practice that people started asking me what I could do for them on the outside as well. So we'll be talking about how I've kind of paired that together. So we will be covering the basics of functional medicine and regenerative medicine, some of the kind of new emerging topics in aesthetics that we're seeing, and how you can put it all together into practice. So functional medicine. What is functional medicine? That's kind of a big buzz term these days. Basically, it's different from standard Western medicine in that we are really trying to figure out the underlying causes of what is causing disease and disorder in the body, as opposed to just looking at symptoms and finding ways to mask those symptoms. So it's really emphasizing the whole person. When I'm doing an intake, I'm looking at everything from their starting point at birth, literally their birth story, their family history, genetics, what is their lifestyle, their nutrition, their stress levels, their relationships, and the aesthetic aspects of health tie into that as well. So we use, a large array of different types of specialty testing, treatment modalities to, again, be looking at fixing the underlying causes so that we can get them feeling better. And sometimes that also means looking at modification of gene expression. Regenerative medicine. So this is really harnessing the body's innate ability to heal itself. The body wants to heal. It's been designed that way. And if we give it the right tweaks, it can do a phenomenal job at getting out of a disease state and back into homeostasis. So really, regenerative medicine is aiming to repair, to regenerate, to replace damaged tissues and organs. And we're utilizing everything from stem cells, tissue engineering, growth factors, and biocues. So as I alluded to in the beginning, I've really merged the functional regenerative medicine along with aesthetics. And when I'm first seeing a patient, we do a lot of biochemistry testing, hormone testing. We do a thorough physical exam, and again, aesthetics come into that. We're looking at their lifestyle assessment. And I really track people's biochemistry, their labs. So from the first visit, I am ordering things like IGF-1, which, if you're not sure what that is tracking growth hormone. Growth hormone kicks in at night when we're sleeping to help us repair and regenerate at night. It's a huge thing if we want to slow down the aging process. We're looking at blood sugar control. So of course, monitoring hemoglobin A1C and insulin. CRPC, which is CRP cardiac, so that's looking at inflammation within vasculature. Sex hormone testing. Have any of you heard of the Dutch test? Maybe, maybe not. That's a kind of a go-to test for me. It's urine-based that patients take home, and it gives us so much insight, not only into what hormone levels are, but the way you're breaking them down, future risk assessment. I also take a look at how people respond to the food that they're eating. Are there any allergies, things that are causing inflammation? Physical exam is huge. And I would say that in dental practice, it is for you too. There's so much that you can learn at doing a good, thorough physical exam with whatever portion of the body you're focusing on. So just an example, if I see that someone has a lot of skin tags, I'm thinking to myself, okay, there's some blood sugar dysregulation here. Melasma, could cue me off to hormone imbalances, lymph nodes, all sorts of things could be going on there. So really, it's a personalized process of getting to know the whole entire picture of the person and then putting together a customized plan for both their internal and external wellness. So it's a lot of fun. So let's talk about some of the trends that are happening right now in what I like to call regenerative aesthetics, because again, we're looking to actually turn back the clock and heal. So I'm sure lots of you have seen all sorts of fun things these days with newer weight loss medications, the GLP-1s, which I'll be talking about later today. So weight loss has always been a thing, but I'd say it's a really big thing now. I really kind of prefer to use optimization because it's not about just losing weight, it's really about getting an optimal level of lean muscle mass, fat, water, etc. So with the FDA approving a lot of new medications, more people are on them, and we're seeing more rapid weight loss, which then can lead us into issues like sagging skin, laxity, kind of being hollow. You may have heard of the term Ozempic, but I have actually seen that in practice. And again, that happens more when people are losing weight too rapidly, that they're losing a combination of not just fat, but also their lean muscle mass. But this is, also a great opportunity to come in and be able to help people with that. So I like to use the energy devices that we have, the radio frequency, to help them, smooth, to help them tighten and lift their skin. You can come in with great products like biofiller, PRF, which a lovely Dr. John will be talking about later today. So there's a lot that can be done to support people who are going through this process and help them do it in a more healthful way. Exosomes. Have you guys heard of exosomes or using exosomes? Yes, some of you are. So another really exciting product, which really, they're vesicles from stem cells that are carrying messages, and they're carrying materials like nucleic acids, nutrients, lipid metabolites. So practically speaking, that basically is really helping people to heal faster and recover faster after procedures like fractional radiofrequency or an IPL. They can be used alongside of threading procedures, and some of them can be actually injected too. It's a little bit different here still in the US than Europe, but that's definitely coming along. Oop. No, what did I do? It was working really well until it wasn't. Tweakments, okay. So my third point, kind of an endearing term. Basically, it's referring to, instead of going and having like the full neck lift, the facelift, these big invasive procedures that can have a lot of risk, and expense, we're talking about smaller things, less invasive procedures that we can do to address signs of aging, to address facial features, create more balance. I think this is kind of becoming very popular in all age groups, but certainly the Gen Z population has really kind of driven it. Some examples of tweakments could include injectables, threads, energy-based treatments, body contouring, biostimulation, intense pulse light, ionizing different products into the skin, which we'll talk about later. The other really exciting thing is being able to treat all skin tones. So when I got my first Viora Sinclair device, back, it was about 8 years or more ago, 9 years, they really were ahead of the curve. So with regards to that, I'm referring to the IPL. So for intense pulse light, many companies traditionally, it was kind of good for maybe Fitzpatrick's 1 through 3. Sinclair, knew ahead of time. They prepared, and they have treatments that are appropriate for all Fitzpatrick skin types, different filters that can be used, different settings that make it very easy to treat everybody. And that's really a must-have. It's a must-have for everybody to have access to these wonderful treatments, and to be able to offer them is really rewarding. So this just sort of gives an example of, on a V20 or a V30 device, what it looks like. So it makes it very easy and intuitive for us, the practitioner, to safely select the settings that we need, and it makes it easy to train staff too. So that's what that looks like. Hair restoration. This is another really popular thing. I was kind of one of the first in my area to jump on this with PRP, so platelet-rich plasma. And I think a lot of dentists these days use PRP and stem cells and things, am I right? Yeah, for different purposes. So it's kind of a natural to add this on for other uses, like restoring hair. So that's just a couple before and after pictures of one of my patients after just 3 sessions. So basically, when you're putting platelet-rich plasma into the scalp, it's going into that vascular layer. It's creating angiogenesis. It is telling essentially the follicles to wake up and go back into the hair growth cycle. And it works really, really well. I'm also going to talk in a few slides about how we can use exosomes for hair restoration. And I've actually, oh, yep. Oh, sure. Yeah, there's a variety of them, and I can talk about them more later, but the ones that I've been using as of late have been Selenus. But there's a number of good companies, and I think that's a really important point because the quality, of course, of what you're using is very important. I'm happy to go over more brands there too. And I don't have affiliations with anyone. So exosomes can be used topically for hair regrowth, which is really cool because while PRP and PRF are amazing for hair regrowth, there's a little bit of a poke and a little bit of a sting with that. And not everybody wants to have their blood drawn or perhaps their health status. We haven't quite gotten them there yet, so I'll talk more about that. And it's actually going to be in the context of electrocurrent. So just kind of going on a little bit more with the PRP. So generally, I recommend starting with 3 sessions. We should see about 50% improvement in that. And then, it's something that you're generally keeping up. So I have patients who've been coming to me for years. They went through their initial round of treatments, and then maintenance could look like 2 to 3 times a year, depending on what's going on. And again, with being a very integrative practitioner, I am pulling in nutrition and educating them about, let's make sure your thyroid is working. Do you have a good iron and zinc status? Are you getting enough protein? All of those sorts of things. How are your hormones processing? So for many men with the androgenic alopecia, for instance, aromatase inhibitors, natural ones like DIM and saw palmetto are products that I use versus some of the pharmaceuticals that can have really negative side effects on lipids. So dermafuse, so kind of panning back to what I was talking about in terms of using exosomes. So I started using my dermafuse, which is electrocurrent-based therapy with my exosomes. And this is so wonderful for patients who either don't want to have the blood draw, aren't in good enough health to use PRP. And so basically, the ion fuse technology is very readily controlled with different parameters, and it's essentially opening up these little cell membrane pores at the lipid biolayer. And you can get the serum in quickly to the right layer, and then it reseals after. So there's no downtime with this procedure. It's very comfortable. And it can be used on your face, your body, and scalp for various things. Of course, right now I'm kind of talking about the use of it with helping with hair restoration. So if you haven't seen the dermafuse, I highly suggest you check it out this weekend. We use that a lot. So that's what it looks like. You can see the larger handpiece and the smaller one, so body or face. The vaginal rejuvenation, I'm not going to touch on this one as much this weekend, but that is something that pairs very nicely with my practice. Yeah? Yeah, so my understanding is that Sinclair is developing a specific product for hair restoration. I've been using a different exosome product until that happens, and I'm happy to share that with you. Yeah, yeah, absolutely. But there's actually studies just on electrocurrent itself helping to restore hair. So, you could use, for instance, the collagen boosting serum, the hydrating serum would not be inappropriate to put on the scalp, and the actual electrocurrent is helping with hair restoration. But when you can get a nice booster on there, like an exosome, then, right, it should be even better. So we offer vaginal rejuvenation, and this really is becoming a very popular emerging treatment to give to women. So it helps a lot with stress urinary incontinence, and that's not even just for people who have had children. There's lots of women that haven't had children that have this issue. It helps with tone, with vaginal dryness, sexual gratification. We pair it alongside of the FemShot or O-Shot with PRP, and it's been amazing. And if anyone has questions about that, I'm more than happy to go over it in more depth. So talking a little bit more about radio frequency. So radio frequency is a non-ionizing form of radiation, so very safe. Essentially what it's doing is it's stimulating cells to oscillate. It's making those mitochondria get excited, cells are bouncing around, we're creating heat, and that is leading to rejuvenation of our collagen and our elastin. So then we get lifting and we get tightening and all sorts of wonderful things. This is the fractional RF that I use. That's what the little adapter piece looks like. And it's really versatile, so we can do everything from, topical ablation for, say, melasma, sunspots, or you can do a deeper treatment that is focusing more on the lifting and tightening. You can customize it so that there's literally no downtime, and like maybe you're going to an event or you're having your picture taken and you just want a nice instant lift and boost. You can do that, or you can go all the way to a much more aggressive treatment where you're getting a longer lasting result. And again, this one can be used on all different skin types. So very versatile, easy to use, and effective. I think I've got some pictures here of patients. So this was after 3 treatments. And both of these particular patients are people who have not had Botox, fillers, or anything else. They were really wanting to do everything aside from that. So I think that's pretty great results for just 3 treatments. And the woman on the left is in her 70s. So pretty cool. So just to put it all together, pairing healthcare alongside of the regenerative aesthetics is absolutely beneficial not only to your patients, but also to your business. More and more people do not have the time or the bandwidth or desire to go to a bunch of different places for a bunch of different things. So being able to offer more to your patients that already trust you is really rewarding and fun too. So if anybody wants to chat over the weekend about how I kind of morphed both together, feel free to come and grab me. And I just encourage you to check out the different devices, try some treatments, and have fun this weekend. Thank you for your time.